Today is Tuesday, October 20th. Thank you for being patient as we work through some technical difficulties tonight. Welcome to a special Facebook update on the COVID-19 pandemic hosted by the Stanislaus County Office of Emergency Services. I'm Linda Muma with Stan OES.
And I'm Amy Collier-Carroll, Public Information Officer with Stanislaus County. Linda and I will both be moderating tonight's update, which will be recorded and posted to the Stan Emergency Facebook page and YouTube channel.
You won't see us on your screen tonight, but you'll hear our voices as we direct your questions to our panelists.
Unfortunately, because of the technical issues we've experienced, we will not be able to address any live questions from viewers this evening, but we will include several questions you sent in throughout the week. Also important to note, our panelists will focus on public health tonight, but we do plan to address the gradual reopening of schools and businesses in the next question and answer forum.
Tonight, Stanislaus County Health Officer Dr. Vaishampayan is here. She's joined by Epidemiologist Chelsey Donohoo and Health Educator Bobby Moser.
So let's begin tonight's health discussion with Dr. V. Dr. V, can you please tell us where we are with transmission rates in Stanislaus County?
Yeah, so we reported 13 cases today and one new death. We have over 17,000 cases reported as of today. We are in Tier 2, which is red and also called substantial transmission.
And Dr. V, will stick with you. Are you seeing any trends with ages, gender, or transmission, anything new and surprising?
Yeah, there isn't really anything new and surprising. Our age group of 25 to 34-year-olds continues to be the predominant age group that we see overall. Our transmission, if you look at our website, we seem to not be decreasing anymore, right? Our spread, we were coming down nicely from our peak, but we seem to be maybe holding steady, hopefully not increasing. Time will tell us. We continue to move forward, but we would certainly like to move down to our orange tier or Tier 3, and right now it doesn't look like we're on track to do that. It looks like we're just staying in red for now.
Thank you, Dr. V. Let's go to Bobby Moser, our public health educator. Bobby, we recently moved into the red tier, which is an indicator of good progress. What changed for us in Stanislaus County when that declaration was made?
Yeah, so I'd first like to thank the public for taking on the responsibility and accepting that they needed to rise to the challenge and change some behaviors to get us to where we needed to be to transition and progress into the red tier. So thank you and congratulations. When we did transition from purple to red, it did open up a little bit more of our community and our businesses. All retail can open indoor operations at 50%. Movie theaters and places of worship can open at 25% or 100 people, whichever is fewer. And gyms and hotels can open at 10% capacity. And of course, these are all with modifications, adopting behaviors such as physical distancing, mask wearing, and cleaning and sanitation. If you have any questions specific to sectors of business or the guidance of how those businesses should reopen, you can visit the state website at covid19.ca.gov, and you can enter in what's open in my county, enter Stanislaus County, and it will populate a list of businesses and the guidelines and what capacity they're open to.
Bobby, this is a three-part question, so I'll ask you the first two, and then if we don't get to the third question, if you don't answer it, then I'll ask you the third. The first two, any predictions on when we anticipate moving into the next tier? How long do we have to stay in the red tier?
Sure, so we don't want to predict anything. So to advance to the orange tier out of the red, we first need to be in the red tier for 3 weeks and meet the requirements for the orange tier for 2 consecutive weeks. And how quickly we progress from the red tier to the orange tier completely relies on how well our public sticks to safe behaviors such as wearing a face covering, physical distancing, washing our hands often, avoiding gatherings with friends and family, and getting tested.
Thank you, Bob. You did answer that last question, which was what needs to happen in order to advance to the orange tier. So thank you for that.
So we'll now go to Chelsey, our epidemiologist who's joined us tonight. Chelsey, this question came in from one of our Facebook viewers, and it says, why are you guys no longer telling us the cases per 100,000? When I started watching these videos back in August, we were at 215 per 100,000, and we're told that once we were at 200 per 100,000, we would move to the next tier. If we've consistently said our cases are going down, why aren't we reporting that information?
Yeah, so that 200 per 100,000 case rate refers to the old monitoring list county variance, which we used to look at to determine stages of reopening. Starting August 31st, we switched to the Blueprint for a Safer Economy. Rather than looking at that 200 per 100,000 14-day case rate, we're now looking at a 7-day average daily case rate. And you can find that metric on our county metric tab on our dashboard.
And Chelsey, we'll stick with you for one more question. Can you please explain what antigen tests are, how they are different, and why they are not being used in figuring out what tier we are in?
Yeah. So when we get the question about antigen tests, it's usually in reference to how are they different from PCR tests, which is something we're hearing a lot about now when we're talking about COVID-19 testing. So PCR tests look at amplified genetic material of the virus, where antigen tests look at specific viral proteins. PCR tests are a little more more sensitive than antigen tests, so they can detect lower levels of virus. So we're more likely to see a false negative with those antigen tests. Currently, CDPH, based on their metric, only uses PCR test when calculating what tier we are in.
Thank you, Chelsey. Next question is for Dr. V. Dr. V, if you test positive for an antigen test, do you need a second PCR test to confirm? Is there a time when you would need a second test?
Yeah, that's a great question because the answer is sadly that it depends. So when we are not seeing a lot of spread in the county or in the area that you're in, then an antigen test should be confirmed with a PCR test. And the reason is that when there isn't a lot of spread, there aren't a lot of positives to be detected. And so while false positives are rare, they become more common when a true positive is rare. And that's just as you mathematically calculate your likelihood of a positive being a true positive. And so as we look at your antigen test, when spread is low, and we're on our way there, then we would like to confirm a positive antigen test with a PCR. When spread is high, like when we were at our peak, then a positive antigen test is usually really good, and we trust it, but a negative test might be a false negative. So it really depends on how much spread there is and the likelihood of the test being positive. That's true for all tests. It's not just this antigen test. That's just true of all tests, and that's just mathematical that it's the way the testing works out. So right now, I would say that we would probably like to confirm a positive antigen test.
And Dr. V, since we're on the topic of testing, what COVID-19 test do you recommend and why?
Oh, another great question. So, and the answer again is depends. And so as we look at the antigen testing, they are not approved by the FDA under their emergency use authorization for people without symptoms. So you should have symptoms to get the antigen test. And again, that's so that we can trust the test result. And then when you're looking at symptoms, you should be within 5 days of the symptoms. The antigen tests are really quite good when you have a lot of virus there, which is great because that's when we really want to know, because that's when you're passing it to other people and spread can happen. So they are a good test if used correctly. And then the timing, and sometimes people need to know right away. And an antigen test, usually you can get the results in, under half hour, certainly under an hour. They're point of care, done right in front of you or, right at the site. PCR tests, however, are sent to a laboratory, a full laboratory, and can take a day or two to come back. And so when you look at your symptoms and your timing of symptoms and when you need the test results back, that's how you should choose which test you will get. And so taking all these into account, I think everybody should be able to make a decision.
Great explanation, Dr. V. Thank you so much. So we know early on it was taking a while to get test results back after people got tested for COVID-19. How long is it currently taking to get test results back?
Yeah, so it's great right now. On our dashboard, it says 1.3 days, which is just really nice. Remember back at our peak when it was just so frustrating, 12, 14, 16 days to get test results back. And that was, the average. I mean, it was really hard and labs were overwhelmed with specimens and they got really behind. But now, we have wide open capacity and our test sites are open and ready to take samples, and the labs are ready to test them. So 1.3 days as the average is a great turnaround time.
Dr. V, we've got one more question for you, and then we'll let you take a breath. But do you know what professions are required to get tested regularly? And secondly, what professions would you recommend be tested regularly?
Yeah, so the Federal Center for Medicare and Medicaid has mandated that staff of congregate living settings, skilled nursing facilities, for example, are tested at least weekly. It depends, the frequency depends on the amount of COVID-19 spreading in the community. Depends on the percent positive tests. So those are the only groups mandated. There was a recommendation in the guidelines for schools for all school staff to be tested regularly.
Thank you, Dr. V. Bobby, this one is for you, and this is another multi-part question, so we'll see how agile you are tonight. Can you explain the testing to us? When to get tested, what it will be like, when to expect results, and what to do while you wait? Also, where in our county are tests being offered?
Sure. So because COVID-19 tests are so widely available, the recommendations have broadened quite a bit. We recommend that you get tested if you have symptoms of COVID-19, if you have been exposed to someone with COVID-19, or if you have recently been in a setting where exposure might have taken place, such as a gathering with friends and family, or if you work in an environment when you interact with the public often, or if you were in a setting where physical distancing and mask wearing were not able to be maintained. So if any of those scenarios apply to you, we recommend that you should get tested. You can get tested by visiting our stancounty.com/coronavirus website and following the Get Tested icons to our testing page. There you can make an appointment at one of our 3 free COVID-19 testing locations in Stanislaus County. Those locations are located in South Turlock, West Modesto, and Salida. Once you make the appointment on the website, you'll get a confirmation email or a confirmation screen on that appointment. You will go to your appointment. Sometimes same day is available when you sign up, so you can go that same day and get tested. When you arrive, they ask to see your identification and your confirmation of appointment just to make sure you are who you say you are. You pull up or walk in, and a healthcare professional will test you for COVID-19 by inserting a swab into your nose. And I was tested yesterday. It's not that bad. It's not anything painful. It's nothing to be afraid of. So if any of those scenarios apply to you, we recommend that you get tested. What to do while you wait for your test depends on the reason of why you're getting tested. If you're getting tested because you have symptoms of COVID-19, you need to isolate. That means staying away from friends and family or even people within your household, wearing a mask whenever you can to avoid spreading symptoms and COVID-19 to people even inside of your household. If you are getting tested because you have a known exposure to someone with COVID-19, you need to quarantine. And you need to quarantine for at least 14 days and after receiving a negative test result. If you are being tested for any of the other scenarios, such as a family gathering or a workplace where you think you may have been exposed, there's a chance you were exposed, you do not need to isolate or quarantine. But if you develop symptoms at any time, or if you receive a positive test, you need to enter into isolation guidelines.
Bobby, I think there was one more question on there that was attached to that group. Where in the county are tests being offered?
Yeah, so the 3 testing sites are located in South Turlock, West Modesto, and Salida. If you want to find other sites not associated with the county, you can visit the state page at covid19.ca.gov, and you can click on the link that says, where can I get tested? And it's a very interactive, useful tool where you can type in your address, and it shows you a layout on a map, all the testing locations nearest to you.
Bobby, another question for you. This came in from a viewer recently as well. Can we please offer tests for those under 18? So that schools may open more safely. Low-income families lack resources to get their kids tested.
Right. So 2 of our county sites do test children 2 years and older. So those are school-age kids that can go to those 2 sites and get tested. Those are the sites in South Turlock and West Modesto, our OptumServe sites. So again, if you visit our website on stancounty.com/coronavirus and follow the Get Tested icons to our testing page, there you can make an appointment for the youth that needs to get tested.
Let's switch gears over to Chelsey. Chelsey, what is the percent accuracy of the COVID-19 tests?
Yeah, so the accuracy of the COVID-19 test, as Dr. V has mentioned, depends on a lot of things. It depends on if the patient is symptomatic or not, when the test is administered, the type of test. Among the FDA-approved tests, we are seeing more false negatives as compared to false positives. So we're asking people if they're symptomatic to stay home and no matter what, keep practicing those basic public health prevention strategies. So physical distancing, wearing a face covering, frequent hand washing, and again, of course, staying home if you're having any symptoms of COVID-19.
Thank you, Chelsey. Another question for you, and we talked a moment ago about this, the cases per 100,000 in the state blueprint. So this question says, can you explain how the state comes up with the cases per 100,000?
So what it's looking at is a daily case rate, but they don't want to look at one specific day, they want to look at a general trend. So they basically pull a 7-day average to see what that daily case rate is. Another thing they factor in is due to lab, the time it takes to process a test and potential reporting delays. We don't want to look at what happened yesterday. We want to give time for the data to become more complete. So they look at this daily case rate with that 7-day lag. So essentially what they are calculating and reporting out for that day looks at what had happened the previous week.
Thank you, Chelsey. Dr. V, we're going to head back to you. This question that came in asks, is there going to be a mandate by the state to require healthcare workers to receive the flu and or COVID-19 vaccine?
So I have not heard anything from the state that they are going to mandate either vaccine in healthcare workers.
Okay, and Dr. V, with the flu season now upon us, why is it important to get the flu shot, and how will the flu impact COVID-19 this fall and winter?
Yeah, so that's a great question because we've really been talking a lot about this and planning for, as people call it, the twindemic. So as we're looking at respiratory viruses, they're both respiratory viruses, right? And so they both cause diseases that seem quite similar, right? Cough, sore throat, headache, aches, muscle aches, joint aches. They can look very much the same. And I do have to say loss of smell and taste is pretty specific to COVID-19. So if you have those, it can tell the difference. But otherwise, it's very difficult to tell the difference. One of the fears one of the things people are worried about is hospital capacity. So we know that in a very aggressive or hard flu season, our hospitals get very full. And if our hospitals are full of flu, then there's no room for COVID patients. And so we need to really work hard to keep both of them, their transmission, their spread low. So we have some prevention measures, right? We have a flu shot, which is very important to get every year. That is the single most important thing that people can do to prevent the flu. But we do not have a COVID-19 shot right now. But we do have our public health measures that you've heard about many, many times, and they work for all respiratory viruses. This includes RSV, it includes all the adenoviruses, everything. So keeping on our face covering, keeping a 6-foot distance, washing our hands frequently and often, staying home when we're sick. These are all the flu messages that we've given, and now we're giving them for COVID-19, and they work.
Thank you, Dr. V. Some good information there. This next question is for Chelsey. Chelsey, this comes from a parent. The question is, I have seen Stantrack mentioned in schools waivers to return to school. Do you have any information on Stantrack? I can't find anything about it online.
Yeah, so Stantrack is a HIPAA-compliant reporting portal in which schools can report both the percentage of absences they see among their student population, as well as report a positive COVID-19 student that may have attended the school. This was created to help us have a timely response in the potential that there is a student who attends the school who is COVID-19 positive, as well as help track what the general level of potential exposures are in our schools.
Very helpful, Chelsey. Thank you. Next question is for Bobby. Again, it's related to students and activities. Can someone explain, this Facebook viewer asks, why it's okay for people to be packed in a mall or 1,000 people at a pumpkin patch, but our kids are still not allowed to play sports? When will sports teams be able to practice again?
Right, so today at noon, Governor Newsom did provide an update that more guidance should be expected soon from the state referring to youth sports. And I think when we look at youth sports or sports in general and the nature of sport, you have many people coming into close proximity to each other from different households with heavy breathing, talking, and shouting. And those are those spreading events that we really want to eliminate. And we are following the state recommendation that the state is not allowing youth sports or any kind of sporting event right now. And these are things that we just really want to continue to advise the public to not gather in those groups and not have kids in close proximity to each other with heavy breathing, such like they would in a sporting event. When we talk about settings such as the mall or shopping centers, we do hope that the mall itself and other shopping centers are sticking to that 50% indoor capacity that the state is now allowing in the red tier, and that also the shoppers are taking responsibility and following those safe behaviors such as wearing face coverings and masks and physical distancing themselves and washing hands before and after visiting the store.
Thank you very much, Bobby. We'll go back over to Dr. V. Dr. V, this is a question from what appears to be a parent. The question is, I would like to know why the county would okay school waivers when COVID-19 and the flu season upon us and children are most at risk at school. Isn't this a risk to families and their extended relatives, teachers, their families, school staff, and others?
So schools are incredibly important to society. They're important to families. They're important to children. There are many services offered through schools. So it's incredibly important to get children in schools. Part of what we've been doing for these last months is working so hard, coordinating with schools to ensure that the children are brought back as safely as possible during this time. So a lot of policies and procedures, processes have been put into place to follow these public health measures that we keep talking about, the wearing of face coverings in school, the keeping of the 6-foot distance, not having activities that are more likely to have gatherings and spread, so like no assemblies. And so schools have been really working hard to make the school day as safe as is possible for the children, for all the staff, the teachers, custodial staff, office staff, everyone. As in all of life, there's no way to take away 100% of risk, as we know from, flu season and everything else. And I think every family has to make a decision whether it's right for their family, for their child to go to school. If the child is high risk, if there are high risk people in the household, I think it's a family decision looking at your individual situation. And then making the decision. The online education is available, and so there are options that are available to everyone. But as part of this planning process and part of the waiver process, we have worked very hard with schools to make the school as safe as possible for the children and staff.
Great information, Dr. V. Thank you. So we have a lot of epidemiology questions this evening as well. So the next few will be for Chelsey. Chelsey, how many of the 604 probable cases are active? This Facebook viewer would like to know. And if we aren't counting the test results from the rapid tests toward our percentages, do we suggest that people who test positive on a rapid test get retested with a regular COVID test, or are we trying to avoid having to count the actual number of positive tests in the percentages? I know Dr. V talked about this a moment ago, but hopefully you can clarify a little bit.
Yeah, I know there's been a lot of questions and conversation about probable cases and what they mean and what they're being included in. Per the state definition of what a case rate is, only PCR cases are being confirmed per the CDPH are being included in our case rate per CDPH case rate definition. When we are reporting out probable cases, even though these aren't being used to calculate that case rate, we did want to let the community know what cases are coming into us, what's being tracked, just to create more community awareness. As Dr. V mentioned, when considering which test to get, antigen versus PCR, there are a lot of factors that go into that decision, including the timeliness needed for that result, as well as the amount of spread currently happening in the community.
Chelsey, we've got another question for you in regards to testing numbers. Is the county getting all negative tests reported to them? If not, how are we able to figure out and report our percent positive?
Yeah. So the tests that are being reported to us are dependent on those tests being reported via the provider or the laboratory. So if a result isn't reported, then we won't have that result. The state does have a larger access to negative test results, and so they are able to, when we're looking at that test positivity as well as that testing rate, they're able to see a little more negative tests than we have access to. So in order to get that daily or to get that weekly metric, we recommend both you can see that rate or that number on our county metrics tab, as well as at the CDPH Blueprint for a Safer Economy website, which will give you that number as well.
Final question for you tonight, Chelsey. I know that on our dashboard we talk about the age brackets of patients who are hospitalized. This user wanted to know, what are the ages of our ICU patients? Do we have that data?
Yeah, that's a really good question. Unfortunately, when we have the number of ICU patients that are being reported to us, that's reported as a total number by the hospitals, and they do not report demographics of those patients. So we don't have access to that data.
Thank you, Chelsey. We're going to head over to our health educator, Bobby. There's several questions for you. The first one is, what can people do to prevent our hospitals from being overwhelmed this flu season as we battle the flu and COVID-19?
Right, so I believe Dr. V spoke to this a little bit, but again, the same protections that we've been using to mitigate the spread of COVID-19 are going to protect us from spreading the flu. Wearing your face covering, physical distancing, staying home when you're sick, washing your hands often with soap and water, using hand sanitizer, and There is one extra precaution that we can use to protect ourselves from getting the flu, and that is to get vaccinated. Please get vaccinated. There are many easy ways to get vaccinated in your community. So please, that's just one extra step to protect yourself and the community from the spread of the flu.
Another question for you, Bobby. Is the county going to be providing free flu shots like in past years?
Yes, the county is offering multiple ways for folks to receive a flu shot at zero out-of-pocket costs. They can visit our agency website at schsa.org and click on our Get Vaccinated Today link, and there they can view a list of all the flu clinics and mobile flu clinics that will be out and about throughout Stanislaus County.
Final question for you tonight, Bobby. There have been several reports about small family and friend gatherings contributing to our number of cases. With the holidays coming up, how should we manage holiday family gathering traditions and those with friends? And what do you recommend folks do this Halloween to stay safe?
Yeah, so you're right on. Many of our outbreaks have been led back to family or friend gatherings, even if they were outdoors. We have people coming together from multiple households, mixing, taking their face mask off, even though they're outdoors. They think they're safe, but they are still within that the bubble of each other, and they're mixing those respiratory droplets. Unfortunately, this Halloween we may not get to celebrate as we usually do. We are definitely in alignment with the state in recommending that folks choose to partake in safe activities and avoid unsafe activities such as parties and door-to-door trick-or-treating. And it is unfortunate, but just one day of lapse in focus and concentration throughout the community, and it can lead to an outbreak, and it could be one of the reasons why we do not progress to the orange tier, or worse yet, slide back into the purple tier. So these are things that we really want to avoid. And again, it's these sacrifices that we all have to come together and make and continue to move forward.
Thank you, Bobby. And speaking of tiers, this final question tonight is for Dr. V. The question is, what last piece of advice can you offer the public to get us to the next tier?
Yeah, thank you for that. I think you've heard us say this repeatedly tonight. We know the public health measures that we can use to decrease the spread of respiratory viruses in our community. It just makes sense, as you all know, keeping as far away from other people outside your household as is possible. We use that 6-foot number, but there's nothing magic that all those respiratory droplets just fall down at 6 feet. It's just a good distance where the majority of the spread will not occur once you're outside of that 6-foot distance. The face covering really helps keep those respiratory droplets from coming from you and getting to other people, and it also has some protection for you as well in preventing you from getting infected. We didn't know these data early on in the pandemic because they just weren't studies. We just didn't do that. But now we're seeing more and more that a face covering is a powerful tool to stop spread of respiratory viruses. We've talked about washing our hands because we know that it can be in our hands and we can touch our face. We talked a lot about that in the beginning of this pandemic. We haven't talked a lot lately about touching the face, but you can still get respiratory viruses by having them on your hands and touching your face. So washing your hands, not touching your face really works there. Staying home with your sick, because that's when you're most likely to spread. So we've talked a lot about these measures. Bobby just talked about gathering and mixing. Really limit your mixing with others outside your household. Will really work to slow transmission as well. And then finally is testing. We've talked a lot about testing during this time, but frequent testing. We've been talking about how test if you have a job that you're frequently interacting with the public, like I would say working in a grocery store, a post office, anywhere that you're working and have frequent contact with the public, get tested every once in a while. if you gather and you mix, you should get tested. Obviously, if you have symptoms or you know you've been exposed, you need to get tested. So testing is a really powerful tool for us to know how COVID is spreading in our community and be able to really work as public health to decrease the spread. So we've been talking a lot about testing, but it really is a powerful tool, and it's widely available in our community. So thank you.
Thank you, Dr. V. A good note to end on. We've gotten through all of our questions sent in from community members tonight. So we want to thank all of our panelists for being here tonight and for providing the community with an important update on the COVID-19 pandemic, as well as guidance to help keep our families safe.
And thank you at home for sending in your questions. If we didn't get to your question tonight, please send it in again. We will work to continue answering them in our social media updates throughout the week.
And please stay tuned for information on another live update to address the plan for gradually reopening schools and businesses in the next few weeks on our Stand Emergency social media pages.
As a reminder, you can find us on Facebook, YouTube, Twitter, and Instagram. Just search for the keywords Stand Emergency.
Thanks again. Stay safe, healthy, and informed, everyone. Good night.